This presentation is an extension of the harassment video available. The information in this presentation is not intended as legal or consulting advice. The U.S. Equal Employment Opportunity Commission, EEOC, released fiscal year 2019 enforcement and litigation data, including sexual harassment charges. Overall, the agency received 7,514 sexual harassment charges, which is a 1.2% decrease from fiscal year 2018. However, 16.8% of charges were filed by males, which is an increase from fiscal year 2018. For fiscal year 2019, the EEOC filed 48 lawsuits challenging workplace harassment, 34 of which raised claims of a hostile work environment based on sex, and 13 raised claims of a hostile work environment based on race. 24 harassment suits sought relief for multiple individuals, 6 of which were systemic cases. If you believe this isn't happening in your organization, think again. Recent harassment cases can serve as important lessons of not only the different forms of harassment that can take place, but also the penalties for employers who can choose to turn a blind eye to harassment or attempt to punish the victims for reporting the issue. Some of the sexual harassment cases investigated by the EEOC last year included cases against healthcare organizations. Let's discuss a few recent sexual harassment cases specifically in healthcare. On October 23rd, the EEOC posted a press release exposing a nursing facility, San Juan Living Center, located in Montrose, Colorado, referred to as Seva Senior Care, or SSC Montrose. According to the EEO's lawsuit, it violated the federal law by tolerating sexual harassment of female employees. Tolerating and retaliating is in direct violation of federal law, since Seva Senior Care received employee complaints and did nothing to stop the harassment or prevent future harassment. Instead, the organization retaliated against the female employee who reported the harassment by suspending her without pay and then firing her within days of her complaint. This recent case has resulted in seeking compensatory and punitive damages for the female employees of Seva Senior Care who were subjected to the sexual harassment. This included back pay to the employee suffering retaliation. In October of 2020, the EEOC filed a lawsuit against Medic One Medical Response, an independent healthcare transportation company providing ambulance services. The lawsuit alleges ongoing sexual harassment and retaliation. According to the lawsuit, the transport company's operations manager repeatedly subjected female paramedics to unwelcome sexual advances, comments, and touching. The manager routinely massaged his female subordinates' shoulders, made inappropriate comments about their bodies, and requested sex in exchange for better work hours. He also sent inappropriate pictures of himself to a subordinate and told her he wanted to have sex. Instead of the company conducting an investigation to gather facts about the complaint, the woman was fired. The result? EEOC is seeking monetary relief for the woman's back pay, compensatory damages, and an injunction intended to prevent Medic One from discrimination and retaliation against employees filing a complaint. In a harassment lawsuit filed against Tegra Medical LLC in July 2020, the EEOC alleged that an employee complained about a supervisor's abusive conduct to the Tegra's Human Resources Department. However, the company failed to take appropriate measures to end the harassment, even though other female employees previously had complained about this supervisor's behavior as well. Instead, approximately 1 week after the employee made her complaint, Tegra retaliated against her by denying her request for leave to care for her son under the Family and Medical Leave Act, resulting in her constructive discharge. If there are allegations of sexual harassment, bullying, discrimination, or any complaint related to harassment at your organization, an internal investigation should be conducted to verify the allegations. The investigation should be conducted by experienced professionals in a discreet manner, and legal counsel should be informed and perhaps even involved. The EEOC provides a number of resources for both employees and employers to report and address harassment in the workplace. Some of these employer resources include EEOC's Harassment Prevention and Respectful Workplace Training. Please check out the checklists and chart of risk factors, which includes leadership and accountability, an anti-harassment policy, harassment reporting system and investigations, compliance training, and a chart of risk factors and responsive strategies. This wraps up our presentation. Consider learning more about healthcare compliance with the American Institute's online on-demand training courses. Visit our certification store. Check out short courses and webinars. Both links are provided in this video's description below. Questions? Contact us 330-241-5635 or visit our website www.aihc-assn.org.